Thank you. All right, today we are talking about blood. Blood is so important on many different levels, okay? It's obviously the fluid or the majority of the fluid that's going to run through the vessels of the body. It's going to carry water. It's going to carry nutrients, all of our macro and micronutrients. So the macronutrients, if you remember, are carbs and lipids and proteins, bringing our body energy and fats and proteins to build the structures of the bodies. Those micronutrients, which are the vitamins and minerals, which help to nourish our body and cause all the microscopic functions to happen. It has platelets, it has red blood cells and white blood cells. So we'll be talking about all those different constituents and what they do in the body. The other thing to keep in mind is the fluid in the blood and in those blood vessels, I should say. Think about the interaction between the fluid in the blood vessels and how it goes out into the tissues, right? Because if the blood stays in those vessels and it doesn't get out to the tissues, it can't carry those nutrients or the water or the oxygen out to those tissues. So we've got to send blood through the vessels, out into the tissues, and then gather it back up, right? Okay? So in order to understand that, we need to understand one thing. I'm going to move in on the board, okay? Or review one thing, I should say. Okay, the blood vessels in the body is what I want to review really quickly. Okay, let's start at the heart. Doesn't really start anywhere because blood is continually cycling through the body. Our blood, our entire blood volume, will filter through the body every 45 minutes. Okay, so if we start at the heart, okay, start at the heart. Blood vessels that move away from the heart are arteries. Okay? So blood vessels that move away from the heart are arteries. One of the main arteries of the body is the aorta. Okay, it comes off the heart, it arches in the arch of the aorta. We have the thoracic aorta, goes through the diaphragm. We have the abdominal aorta, sends blood out to the extremities as well as to the arms and the head and neck, okay? So arteries move away from the heart. As those arteries move away from the heart, they get smaller and smaller, and they turn into arterioles, okay? So blood is still moving away. Arterioles are going to be smaller vessels than arteries. The thing to keep in mind is, once again, we've got to interact the blood between the blood vessels and the tissues. So at some point, it's got to leave blood vessels and go out to the tissues, okay? So what's happening by the arteries leading to smaller arterioles and then to even smaller capillaries is we're creating in capillaries a very small, thin blood vessel. It's only one cell layer thick, or thin, I should say. And through those capillaries walls pass the nutrients, the white blood cells, the water, the oxygen, and the carbon dioxide that we need to nourish tissues, and also all those wastes that we gather from the tissues to send back to the heart. Okay? So blood leaves the heart, goes to the arteries, goes to the smaller arterioles, goes to the small capillaries, which are formed in actually areas called capillary beds, where there's multitudes of capillaries bunched together. We exchange substances from the blood to the tissues, from the tissues to the blood, and then blood will then leave those capillary veins, capillary beds, by venules. Okay, and venules are small veins. Veins move towards the heart. Okay, towards the heart. If you don't remember the major blood vessels of the body, it is time to review major clinical stuff that you will absolutely need to know. Okay, aorta, common iliacs, external and internal iliacs, subclavians, brachial, cephalic vein, just rambling off some that'll be important for you to know, carotids, jugulars, femoral. Okay, these are all major, and I'm sure I left some off. I'm just rattling a few off. Vessels that you should absolutely review, okay, to know clinically. okay? So, good, great little review. Let's move in on the screen. Excuse me, I still have a cough. Talk about some of the functions. Transportation, regulation, defense. What would defend in the bloodstream? White blood cells would cause defense, right? White blood cells are going to help our body fight any infections, bacterial, parasitic, fungal, viral, okay? The average amount of blood in the cardiovascular system is 5 to 6 for men, 4 to 5 for women. So 5 is a good average, okay? Functions of blood. Okay, we talked about this. Also, one thing we didn't talk about is hormones, okay? Don't forget that hormones will travel through the bloodstream, okay? Hormones from endocrine glands. Regulates body temperature, okay? Helps to buffer pH. Normal pH in blood is going to be 735 to 745. That's in the blood. Don't forget that in different compartments of the body, the pH will vary. In the blood, it's 735 to 745, okay? We also, another important concept, we need an adequate amount of fluid in the circulatory system. Let's talk about a concept called shock. Okay, shock in general is when there will not be enough fluid volume in the circulatory system to adequately perfuse the tissues of the body. So if there's not enough fluid volume in the circulatory system, we can't push that fluid out into the tissues to get the oxygen and nutrients to the tissues that we need to get to them. Okay, that is shock. Protects against blood loss. Okay, plasma proteins and platelets are going to initiate clot formation. We will have substances in the blood that are just waiting to form clots. As a matter of fact, your body's always forming clots. But we have substances to break those clots down, so we're constantly preventing clots from forming. If we were to take a big old, machete knife and cut our arm open, we immediately in that area have plasma proteins that are in the blood and platelets that are in the blood that will sneak out of the blood that will start to clot in that area. It fights against, our blood also fights against infections. Okay, there's white blood cells. We're going to talk about all the different types of white blood cells in a couple of screens. There's also something called complement proteins. Complement proteins are proteins in the blood that if we have an infectious agent, they will lock onto that agent and call white blood cells to that area. Okay, so they're little soldiers that are constantly looking out for infections in the blood. We also have substances called antibodies. Now, antibodies are going to create antibody-antigen complexes. So if we have a substance enter our body that is foreign to us, it is called an antigen, A-N-T-I-G-E-N, antigen. Our body will form antibodies against that. Those antibodies are preformed proteins that will be ready to fight off that antigen should it come back again. Okay, perfect example of this is going to be immunizations. When you get an immunization, basically they're giving you a little bit of that antigen, just a little bit, so your body will form antibodies against it. Those antibodies hang out in the blood. Should you ever get exposed to that antigen or that foreign substance again, you have that immediate immune response to fight it off. Excuse me. Okay? So formed elements. We have red blood cells. Red blood cells look like little Werther candies. I'll show you a picture in just a minute. They're biconcave. They have no nucleus. And they only live for about 120 days because they have no nucleus. They can't reform any proteins. White blood cells are complete cells. We're going to go through a whole list of those white blood cells, okay? Platelets are actually just little bitty fragments. They're little flaked off fragments that we find in the blood that will help with blood clotting, okay? So most formed elements, those white blood cells, they can survive for a few days, okay? Some white blood cells actually will live in tissues for a long time. So it depends on the white blood cell actually that we're talking about. Red blood cells only last for about 120 days, okay? So most blood cells originate in the bone marrow, primarily hip, shoulder blade, proximal humerus, proximal femur, okay? And they don't divide once they've come out of that bone marrow, okay? So formed elements, or the cells. Here's a great picture. If you can't see this picture, once again, open up your book to the red blood cells, to the blood lecture, okay? There are different types of white blood cells, a monocyte, a lymphocyte, a neutrophil. We'll talk about those in a little bit. Little chunks of cells called platelets you can see up in the left-hand corner. And erythrocytes are red blood cells. You can see those are erythrocytes, don't have a nucleus, okay? They're biconcave. I'll show you a picture of that in just a minute, okay? There's a reason for that. It actually increases surface area. And red blood cells' primary purpose is going to be to transport oxygen, okay? And carbon dioxide. So, hematocrit. Hematocrit, you may be familiar with this, you may not, is a blood test. What it does, I have that little title there, Spin It Hematocrit, because you take a blood sample from someone, you put it in a tube, you put it in a centrifuge, you spin it, and what happens is the heavier elements go to the bottom. Those heavier elements, or the heaviest elements in plasma, I should say, are erythrocytes. Erythrocytes, this is once again right in your book. If you can't see it, open up your book to blood. Erythrocytes, or red blood cells, are going to be about 45% of whole blood, okay? It's the most dense component because it goes to the bottom. The buffy coat is going to be white blood cells. White blood cells, or leuco means white cells, leukocytes, and platelets are going to be less than 1%. Plasma should be about 55%. So if we test somebody's hematocrit and their erythrocytes are only 30%, it wouldn't be quite that low. Let's say they're 40%, okay, they're going to have a decreased amount of red blood cells. So that means there is something wrong with the creation of their red blood cells, and that in turn means that they're not going to have enough oxygenation, okay? So hematocrit's going to give you a good idea about the amount of red blood cells that a patient has in their system, okay? Hematocrit, percentage of blood volume, that is red blood cells, okay, there are the ranges. A good general number that we'll use for this class is 45%, okay, 45%. Okay, so physical characteristics, sticky, opaque, color scarlet to dark red. Blood does not turn blue. Okay, if you take a second, look down at your arms, you can see your veins. I have really great veins. If you can't see yours, you could look at mine in lab, okay? And they look blue, don't they? Well, blood doesn't look blue. It actually will turn like a scarlet color that through those blood vessels looks a little bluish. And then if it's really oxygenated, it's just come right out of the heart, you know, it's come out of the lungs to the heart, it's being pumped out to the body, it turns a nice dark red. pH, we talked about 735, 745, about 38 degrees Celsius, approximately 8% of body weight. Okay, so once a good average volume of blood in a person is going to be about 5 liters for everyone, we could say. Obviously a little bit more for males. Now what can happen with people is it's good to know those averages, because if you think about it, if somebody has a duodenal ulcer, okay, this happened to my grandmother, and that duodenal ulcer lets blood from the body, from the surrounding blood vessels, will actually leak into the intestines. Okay, so bear with me here. If it leaks into the intestines and they're bleeding a lot, or if they have a gastric ulcer, same thing can happen. Okay, blood can leak into the stomach, leak into the duodenum, and it goes into the feces. They'll start to lose blood through the GI tract, okay? Losing blood is losing blood. Same thing as if you cut your arm open. You're gonna lose blood out through the feces just as you would lose blood to the external environment. Okay, my grandmother got very sick. She had bad duodenal ulcer. She was down to about 2 liters of blood. Okay, so what happens is, once again, they don't have enough volume in their cardiovascular system. They start to go into shock. The heart doesn't have enough blood returned back to it to pump back out, because don't forget, the heart's going to oxygenate the blood, send it back out to the tissues. Blood levels decrease, the heart senses that. In response to that, the heart will start to beat faster, tachycardia, trying to get more blood out to the tissues. Okay, so that loss of blood and those levels of blood or those amounts of blood are good to know, because we need that amount of blood so it can be forced out into the cardiovascular system. We can push it out to our tissues, get nice oxygen and nutrients out to our tissues, and then bring it back to the body. Okay, so let me pull back here. Excuse me. Okay, plasma. Plasma is going to be that pale yellow liquid. It's going to be mostly water. It's going to carry all those macro and micronutrients that I talked about. But the other thing is there are several proteins that will be located in it. Okay, albumin. Albumin is going to be a very important protein that you need to know. Albumin is going to attract water. What albumin does is it helps to pull water back into the cardiovascular system after it's perfused into the tissues. Okay, so we send blood out by the aorta, goes out to the tissues, goes out and sends nutrients and oxygen to those tissues. We got to pull the blood back in, right? Because it's going to want to stay out there if we don't force it. Okay, the protein albumin that's in the blood will help to pull the fluid back into the bloodstream to keep it from staying in the tissues. Okay, globulins. Globulin is another protein. What that does, though, one of the big things that globulin does is it will transport antibodies. Okay, it forms antibodies in the bloodstream. Okay, so globulins are important. Clotting proteins are exactly what they say. Clotting proteins hang out in the bloodstream looking for injuries so they can clot and fix those injuries. They do clot, and we will actually break them down by plasmin. We'll talk about plasmin in a little bit. Okay. Macronutrients we talked about, your carbs, your lipids, your proteins, electrolytes, sodium, potassium, calcium, okay, oxygen and carbon dioxide. Red blood cells, here we go. Here's that picture. If you can't see it once again, take a good look in your book. The red blood cells are structured, I'll draw this in red for you. If you're looking at it from the side as a biconcave disc, let me zoom in on that. As a biconcave disc. I am such a bad drawer, I'm sorry. Okay, so what that means is it looks like a Werther candy. If you don't know what a Werther candy is, look it up online. Biconcave disc. If we're looking at a red blood cell from the side, it looks like it's dipped in. If we're looking at it from the front, it'll look like this, but it's solid, okay? But that biconcave presentation increases surface area. So it's able to transmit carbon dioxide and oxygen easily from its surface, okay? No nucleus. That's why after 120 days it dies. The nucleus, don't forget, is going to have DNA. DNA is a template to make the proteins for that cell. If there's no nucleus, the cell can't create new proteins. It cannot live for a long period of time. After 120 days, this red blood cell will go back to the spleen. The spleen is basically the graveyard for red blood cells, breaks down red blood cells, send those byproducts to the liver to be excreted. Okay, and we'll talk about those steps in just a little bit. Each red blood cell contains 250 million molecules of hemoglobin. Hemoglobin is a protein structure that has 4 subunits. Within those 4 subunits is a little iron. Okay, so within each hemoglobin, we have 4 subunits of protein. In the center of each one of those protein subunits is a little molecule of iron that holds on to oxygen. So each one of the hemoglobin units can have 1, 2, 3, 4 oxygen molecules. Within each red blood cell, we have 250 million. You do the math. That's what, a trillion? A billion molecules. Sorry, can't multiply. Okay, a billion molecules of oxygen per red blood cell. Okay, so it can carry a lot. It's pretty efficient. This is also why iron's important. You hear people being anemic, but they don't have enough iron, because that iron is what the oxygen latches onto in the red blood cells, okay? Oh, perfect. Here's our little view of a red blood cell, much better than my drawing, okay? Much better than my drawing. You can see it's biconcave, it's got a little dip in the center, okay? Gives it more surface area. Fantastic. Hemoglobin, okay? Hemoglobin has those 4 chains. They're protein chains. There are 2 alpha, there are 2 beta. What that means, and actually we went over this in the first semester, it's their different structures or configurations, okay? We don't need to review that at this point. If you like, you could go back to AMP1 and review it, okay? It's how they're actually physically structured, okay? But the important thing to remember is each hemoglobin has 4 chains, 2 alpha, 2 beta, with the iron in the center. 1 oxygen per iron, so 4 per hemoglobin. I'm sorry, 4 per hemoglobin, not red blood cells. Okay, blood cell creation. We are not, this is a very complex process. What I want you to know is that all blood cells, red blood cells and white blood cells, come from hemocytoblasts. Okay, they're a stem cell. Okay, they're a stem cell. Platelets, also, the other thing that I want you to know is platelets come from megakaryoplasts. Okay, and those megakaryoplasts, it's kind of cool. Those megakaryoplasts are like really big, honking big cells that have little projections that stick out. And instead of that megakaryoblast leaving the bone marrow, because all of these cells are created in bone marrow, the megakaryoblast actually is this big cell that can't leave the red bone marrow, and it sticks little projections of its arms out into the bloodstream, and it gets ripped off. And those little ripped off parts are platelets. Erythrocytes start with a nucleus and they lose it. So that I don't really care if you remember or not. I shouldn't say I don't care. I do care. But what I want you to remember is hemocytoblasts are the stem cells that all blood cells come from. Megakaryoblast is what platelets break off of. Okay, erythropoiesis and red blood cell destruction. So we talked about red blood cells being created in the marrow of bones. Okay, kidneys, and very, very important. Kidneys monitor the levels of oxygen in the body. If the levels of oxygen decrease too much, the kidneys will release erythropoietin, okay? Erythropoietin will stimulate the creation of more red blood cells. Now, here's the funky thing. Athletes believe that using commercial erythropoietin, okay, which is actually created for people with renal disease, athletes will use commercial erythropoietin to increase the levels of red blood cells so they can increase their oxygenation, so hopefully they think they can perform better. Now, here's the thing, that if you have too many blood cells, red blood cells, you can actually increase blood clots and throw a clot. Okay, very bad. And it would be worse in males because, as you can see from the side, testosterone will aid in its effects. Red blood cells have that 120-day lifespan. Now, the spleen is going to be the graveyard for red blood cells. Liver will also break them down. What happens is those red blood cells then are broken down into bilirubin. Okay, bilirubin actually gives feces that brownish color. And what also will happen is amino acids will be released from those red blood cells again. Body takes those amino acids, remakes red blood cells, and the structures of red blood cells, and bilirubin will be excreted in the feces. Okay, so that's a constant event, constant physiological process in the body. So causes of hypoxia, obviously hemorrhage, right? If you're losing red blood cells, insufficient hemoglobin, generally due to iron deficiency, reduced availability of oxygen at high altitudes. But the cool thing about that is, let me zoom back out, excuse me. The cool thing about that, kind of an interesting little side note, is when people go to higher altitudes, the level of oxygenation is lower. So some athletes will actually train at higher levels or higher altitudes. Their body will inherently make more red blood cells. So when they go down to more of a sea level type of altitude, they have more red blood cells, they're more oxygenated, they can perform better. And it's better than the commercial erythropoietin because our body will not inherently make enough red blood cells without that commercial erythropoietin to cause any damage or blood clots. So kind of a cool thing. Okay, fate and destruction. So here we go. Excuse me. The next slide, fate and destruction of, okay, erythrocytes. We talked about this. Okay, hemoglobin is broken down to heme and globin. Okay, iron is reused. It's repackaged into compartments that are safe for the body to carry through the blood. Will create more red blood cells in the marrow. Okay, heme is degraded to that yellow pigment called bilirubin. It's called stercobilin, and the feces gives feces that brownish color. Okay, liver will excrete that bilirubin. Degraded pigment will leave. Oh, there we go, stercobilin. Okay, and then globin is broken down to amino acids and reused. So we kind of talked about that already. Iron storage. Iron is toxic when it's free in the body. So we need to put it into forms, okay, and these are their three forms. Ferritin, hemosiderin, and transferrin are all stored forms of iron, either in cells or in the bloodstream with protein around it, okay? The little side note, another thing. It's really important not just to take iron supplements. So if you're feeling tired, okay, which we all are, it's the end of the semester, right? Wow, maybe I'm anemic, I'm just gonna take iron. Very, very bad idea. Iron is very toxic when it's free in the body. If you take high levels of it when you don't need it, it can become free and cause damage, especially in the liver, okay? If you're feeling anemic or tired, you absolutely wanna go and get your blood levels checked before you take anything. Okay, white blood cells, the other name for white blood cells is leukocytes. Okay, leukocytes. People get confused because there is a white blood cell called a lymphocyte. Okay, lymphocyte is a white blood cell. Leukocytes is a general name for all white blood cells. Excuse me. These are also produced in the red bone marrow, removed by the liver and spleen. Okay. There are granulocytes and agranulocytes. Granulocytes are going to have granules in it, okay? Those granules are what are stimulated when it's fighting off an infection. Agranulocytes are going to be without those granules. I'll talk to you about those in just a second. Now, here's one important difference. Red blood cells do not leave capillaries. As a matter of fact, if we are to zoom in on this picture, I'm so sorry, excuse me. If this is a red blood cell passing through a capillary, the capillary is, let me just get a color that's different. The capillary is just the right size for that red blood cell to pass through, okay? What this does is it allows that red blood cell to have as much contact as possible to the endothelium of the capillary. So that way we can readily exchange carbon dioxide and oxygen. So oxygen will leave the red blood cell, go out to the tissues. Carbon dioxide leaves the tissues, goes into the red blood cell. Okay, so pretty efficient. Now, white blood cells can leave the capillaries, okay? So what'll happen if we have an injury, get the machete out again, I cut my arm, if we look at the capillaries that are in this area, and we look at a side view of the capillaries, in a capillary that we're not having any immune response happening, the cells of the capillary are pretty tightly junctured together, okay? If I get the machete, cut it open, I introduce all sorts of bacteria into that area, what happens is this capillary, the cells will shrink a little bit, okay? And when those cells shrink, they'll actually open up spaces between them. Now, white blood cells cruising down this capillary will start to sneak their way out, go out into those tissues that now have bacteria in them and start to work on that bacteria, okay? So, in capillaries, white blood cells can sneak out. That's an important process, an important thing to know so they can do their job, okay? Once those, in positive chemotaxis, so once those cells, these white blood cells get out into this tissue, okay? these white blood cells actually will release chemicals. These chemicals will draw other white blood cells to them. They can smell it, per se. Okay, not really. But they get drawn to that area. It's called positive chemotaxis. Okay, so more and more white blood cells will come there to fight off infections. So two types, looking at the next screen, two types of white blood cells. Okay, two types of white blood cells. There are granulocytes and there are agranulocytes. Granulocytes I've nicknamed Ben, okay? Actually, let's go in on that screen, okay? Ben. Basophils, eosinophils, and neutrophils, okay? There's a lot on this page. I think three of the most important ones, well, let me finish this thought. Agranulocytes are monocytes and lymphocytes, okay? Now, neutrophils are going to fight off, I was just thinking about something. Neutrophils are going to fight off bacteria, okay? So those are going to be a biggie, and they actually are about 60% of the white blood cells in the body. Lymphocytes are going to fight off viruses, okay? Viruses are a big infectious agent. There's about 30% of white blood cells are going to be lymphocytes, okay? Monocytes are going to turn into macrophages. And those macrophages will eat up any infectious agents, but they're also really important. If we have any tissue that's breaking down, those monocytes or macrophages will help to eat up that tissue and clean it up. Okay, so I really feel like those are three of the most important. Basophils are also important too. Basophils will release histamine. Now, histamine will vasodilate or open up blood vessels. If you think about an antihistamine will prevent basophils from releasing histamine, will prevent vasodilation, okay? Vasodilation will bring more blood to an area, will let more fluid get into tissues. If we put a lot of fluid into tissues, we get swelling, we get release of mucus and serous exudates or fluids, right? So histamines are going to promote kind of those allergic sort of responses. Antihistamine medication will prevent that vasodilation and that exudate from happening, okay? Eosinophils always kind of gross me out. Well, they don't gross me out, but they fight off parasites, which kind of grosses me out. So maybe that's a good way to remember it, okay? One way to remember these percentages that I've used in the past, because these are great cells to remember. The mnemonic is never let monkeys, I'm hoping this is big enough, hope so. Never let monkeys eat bananas, okay? And what that does is it tells us approximately not the percentages, but the distribution or the amount of white blood cells that we have in the blood, in the body, in the bloodstream, okay? Neutrophils, lymphocytes, monocytes, eosinophils, and basophils. And I made up another little thing that helps you to remember the approximate percentages. Because what happens if somebody has an infection, they will do something called a white blood cell differentiation, okay? They'll actually sit and look at how many white blood cells are in the tissues. If there's a high number of neutrophils, they have an inkling that it's a bacterial infection because neutrophils will fight bacteria. If there's a high level of lymphocytes, viral infection. High level of monocytes, macrophages, infectious, okay? Eosinophils, parasitic, basophils, some sort of allergic kind of reaction, okay? So a complete white blood cell count will give them an idea of maybe what sort of infectious agent may be happening. So I do think that it's important for you to know these approximate percentages, so I tried to make something really easy. Well, your book made up this, but I made up these percentages, 70, 40, 7, 4, 1. These are really gross estimations, okay? Because this is actually 60, this is 30, but 70, 40, 7, 4, 1. 70, 40, 7, 4, 1 was an easy way for me to remember the approximate percentages of white blood cells that are in the body, which would be a good thing for you to know because clinically speaking, that may come up if you look at a complete white blood cell count, okay, or diff. All right, good. So platelets, looking back at the screen, I'm going to switch back to the screen here. Platelets are going to be those little chunks that we'll see in the blood that'll promote clotting, okay, those cell fragments from megakaryocytes that'll decrease with aspirin intake, okay, so aspirin will thin the blood. They're also decreased with hemophilia, which is a genetic disease, okay? Thrombocytopenia is not genetic. That can come from cancer where you're not producing in impaired liver function, as you see, enough platelets, okay? Both of them, or all of them, I should say, will cause a deficiency in clotting and also severe bruising, okay? Hemostasis. This is what stops bleeding, okay? So what happens, these are the steps that will happen when there has been an injury, okay? So if you imagine in your mind a little blood vessel that's contributing towards this healing process called hemostasis. Hemo is blood, stasis is stopping that movement. We want to stop that movement so we can send platelets to that area or keep platelets in that area. That clot can form. If blood keeps rushing by, it's going to flush that platelet out. We also want to slow blood down so we can let white blood cells do their job in that area, okay? So hemostasis, stopping the movement of blood so it can heal. The first step is going to be vascular spasms, okay? That'll slow the blood to that area, okay? A platelet plug will happen where platelets will join together, start clotting to close up the area that's damaged. Coagulation is a series of enzymes. It's a whole, you can see I listed some of them there, okay? These are the ones that I want you to know, okay? There's actually, I think 13 steps to this coagulation cascade. For our purposes here, I want you to know fibrin, done. Fibrin is going to be the or activated fibers, which will close that hole together. Okay, so platelets are the little chunks that will start clotting. Fibrin is fibers that will also actually crisscross that injured area and help to hold the opening together, okay? Then the clot will start to retract. Fibrinolysis will then happen, okay? So I spoke to you about how we're constantly creating clots in the body and breaking them down, okay? Plasmin is the substance in our blood that will break clots down, okay? So clots form, plasmin breaks it down. Clots form, our body says, oh, there shouldn't be a clot there. Plasmin breaks it down. There's a substance called TPA, tissue plasminogen activator, okay? We can't have plasmin working all the time. Okay, if it did, it would thin the blood too much. The body needs to know there's a clot, we activate plasmin, it works, it goes into its inactive form. So plasmin has an active form and an inactive form. That inactive form, it's right in your notes, is plasminogen. Okay, so plasminogen is hanging out in the blood, finds a clot, the body uses tissue plasminogen activator, which is an enzyme that turns plasminogen into plasmin. Plasmin breaks the clot down. Okay, so this is always happening in the body, but if we have an injury, form a clot, can't stay a clot forever, right? The goal is to eventually fix that tissue to be close to what it originally was. So we form the clot will start to break down as the tissue starts to heal, okay? Plasminogen will break that clot down, and as the clot is broken down, we'll reestablish the connective tissue that was originally there, okay? Macrophages come in and clean it up. Plasminogen breaks down the clot. The body will start to lay down fibers and cells, okay, in the extracellular matrix, try to reform it back to where it used to be. Okay, so plasminogen or plasmin will be important breaking that clot down. TPA is also important clinically speaking. TPA will be administered to people who have thrown a clot. Okay, needs to be done, I think, within the first 8 hours, okay, 4 to 8. Somebody correct me if I'm wrong, okay. TPA, people call it, needs to be administered quickly. If a clot is formed, it can actually go in and break up the clot and prevent damage from happening in that area, okay, so TPA. normal substance in our body can also be administered, clinically speaking. Now, go back up. Okay, so here's a picture of those steps of hemostasis. Okay, once again, it's right in your book if you can't read it. Anticoagulants, anticoagulation, or clotting. Okay, heparin is natural anticoagulant, can also be given. Warfarin is the oral form of this. This is, some people are more prone to creating clots than other people. Okay, they're given this blood thinner to thin the blood down. Okay, vitamin E is a natural anticoagulant. Got to keep in mind, you need to know people's supplements as well as their medications. If somebody is taking warfarin, okay, if a woman is taking warfarin and she has thick blood per se, she forms clots, she has that blood thinner, and she also heard that vitamin E helps with menopausal symptoms, and she puts them together, it could be very bad. Okay, she can thin the blood so much that if she does cut, she can actually hemorrhage. You need to know supplements as well as medications. Okay, aspirin is a blood thinner as well. It prevents those platelets from forming clots. Okay, human blood types. Okay, here's the thing. This is going to be an important thing to know. Human blood types. So we've got different groupings of different blood types. And you know, before this, I'm actually going to pause the tape and restart it. Okay, so pause the tape or fire up the next one, take a quick break, get a cup of coffee. I'll see you right back here. Okay.